very lucky to learn from and to work alongside what Bob Dupont, who was the founding director of the National Institutes of Health, called us the dream team, which I'm not trying to congratulate myself. I think he was mainly speaking of Keith and our other colleague, Tom McClellan. But the three of us working together in the first year of the Obama administration, when, if you can imagine, in the United States, support for the president was 81% among all political parties, if you could ever believe it, that first year of that presidency. And it was really a very interesting time to be in Washington, a very different and very special time. And I was lucky and continue to be lucky to learn from Dr. Keith Humphreys, who's an endowed chair at Stanford University, who has done work for over 3 to 4 decades in the VA, working with veterans and hard-to-reach populations, and is one of those very few people who've not only published a zillion papers and is a incredible fixture at a university. They'll never let him go, but is someone that can speak to policymakers and do so effectively and actually implement the principles that they're researching. That's a very, very rare thing. So I'm really excited for Dr. Keith Humphreys to be joining us today. Thank you.
All right, I admire your endurance. Thank you, Kevin, for that very nice introduction. This was going to be the send you home speech, but instead it's going to be the run for the border speech for me. I'll tell you a story. When I was in college, I had a close friend whose father, unfortunately, was really seriously addicted to alcohol. And it blew the whole family apart, estranged him from his children, divorce, a lot of other problems. But in midlife, his dad had a rally. He pulled together 3 or 4 months of sobriety. After years of unemployment, he landed a terrific job. He started to get back in touch with his kids. It seemed like everything was going to turn around. And as sometimes happens, that was the moment that everything went bad. He relapsed, he got in a car in the interstate, he drove the wrong way. He hit a concrete barrier and he died. I went with my friend to the small town where the family had grown up in Ohio. And the preacher there had known them forever and knew about all the struggles and the ups and downs. And he said something that has stayed with me for 40 years, and it's this: in the face of things like this, our faith is sorely tested, yet it is precisely in the face of things like this that we need our faith the most. I am not a member of the clergy, but I am comfortable taking advice, good advice, where it comes, so I'm going to take that religious advice and put it into the policy arena as follows. The experience of trying to make good drug policy has many parallels to the experience of addiction. There is pain, sadness, frustration, and setbacks, which can rob us of our hope that things can ever get better. But it's precisely in such situations where we must have hope that things can be better. So I thought, in what was going to be the closing moments, I would just tell you 5 things that give me hope. And by that, I don't mean California, happy, clappy, naive hope. I mean realistic, hard-headed hope that those horrifying numbers that we saw during Kevin's talk are not destiny, that we can change that. So the first thing is this: no epidemic in the history of the world has ended by waiting for people to get sick and then trying to take care of them. That's not how COVID ended. That's not how HIV was brought under control. It's through prevention, stopping people from getting in trouble in the first place. We understand, the first thing that brings me optimism is we understand more than ever before how to help young people grow up healthy. And I don't just mean in avoiding drug use. I mean in succeeding in life and avoiding all the things parents worry about with their kids. The image of prevention that we have, and when I say prevention, I see this in people's eyes, is either a cop waving a billy club in the schools and talking about pot, or maybe a charismatic person who's in recovery giving a talk in junior high school. That's what people think of. But to think of that as the cutting edge of prevention is like thinking of the Tandy Radio Shack computer as the cutting edge of computing. That's what we did 30, 40 years ago. We have much more effective, wiser things today. I would really urge you to take a look at the site, Communities That Care, It's one word. The American government has it up. This is a developmental program for kids that invests in kids around the ages of 10, 11, and 12. And it helps them with generic capacities that help them avoid all kinds of problems. These are things like bonding with your school, bonding with pro-social adults, recognizing your emotions and learning how to manage them, learning how to cope with stressful situations. The studies you can see on this site with over 4,000 kids in them shows that not only do those investments reduce drug use initiation by about a third, and smoking by about a third, and alcohol use by about a third, but 10 years later, these kids are 20% more likely to go to college based on investments made when they were 10, 11, 12 years old. We have trouble sometimes getting the will to invest in prevention, but at least we know what to do, and that gives me hope. Second thing is we have a better understanding of the things that help people who are addicted get into recovery. Some of them are old. AA is almost 100 years old, incredibly. It helps a lot of people. Methadone is over 50 years old. It helps a lot of people. But it's not just that. There's a lot of exciting things going on. There's people developing apps and interventions, digital interventions that people can access anytime. There are medications in the pipeline. There are people using brain stimulation techniques, something called RTMS that I'm quite excited about. These things, as they come out into the world, are going to save more lives. As long as we are open to the idea that there are many pathways to recovery, and there's lots of ways for people to get better, we will profit from that. So that is the second thing that makes me really optimistic. The third thing is we now have very good models that have been shown to work in lots of districts for the large group of people who will not seek help voluntarily, but are in the criminal justice system because they drank and drive, or they stole something, or they broke into someone's house, or they committed assault. And it doesn't have to be the kinds of things we used to do before, like throw people into a prison for years. So I think Kevin may have mentioned in his talk 24/7 sobriety, which starts in South Dakota. But that's an example of this, or hope probation for people with stimulant drug problems. It transforms how the criminal justice system monitors people from slow, unpredictable, and harsh to something swift, certain, and fair. And swift, certain, and fair consequences change human behavior. In these programs, people are tested regularly, and they are given immediate consequences for use and for non-use. If you're in 24/7 sobriety, you're going to blow a breathalyzer every morning and every night. If it's negative, you get an immediate reward, another day of freedom. Even though you've drunk drive 3, 4, 5 times, you get to stay out. If it's positive, they're held overnight in a cell, just one night. Even though many of these folks have been imprisoned, you think one night can't possibly matter. It does matter because it's completely predictable. They've done over 10 million tests in South Dakota with this program. The proportion of tests where this person has shown up and blown negative is 99.1%. This program is now spread through 12 different states. It has spread through England and Wales, and Blair Gibbs was a big part of that, spreading through England and Wales. Just had interest in Australia. We need it in Canada, but again, we know what to do. We have ways that are therapeutic, and they actually make people live longer, don't fill up the prisons, and keep the public safe. The fourth thing is, I think reality is our friend. Reality makes an impression on people. It takes a while, but it does make an impression on people. So people who live entirely in an ideological world can recover. That's what I would say. So I look at what happens. We had the terrible murder of George Floyd and international appropriate outrage at the police brutality, particularly as directed towards African Americans. In my region of the country, from San Francisco, Portland, Seattle, for a few years, that got generalized into a sense that we didn't really want police to negotiate public space anymore. If a family wanted to go play in the park and the park was an open-air drug scene, the police were to not get involved. Or if there was a dealer on the corner, the police were not get involved. Or if there was somebody who was passed out on your stoop and you were trying to run a business and you were going bankrupt, the police would not get involved. That was worse than nothing. I would just say in the last 18 to 24 months, reality has made an impression on the people who believe that. And if you look at how they have voted and things like district attorney elections or the new things they're asking of police, I see a return to sanity. By sanity, I do not mean a war on drugs. I do not mean a carceral racist policy, but I do mean recognizing that public space is for all of us. People who use drugs matter. People who don't use drugs matter. And we have to sort that out, and sometimes we need law enforcement to do that. And it's remarkable to me, I go up to Oregon a lot, go up to Washington a lot, how many people say, I really thought this would work, but I changed my mind. And it's encouraging because we all know people, it seems like evidence can never sway them. But in this case, people were really swayed. They tried something different, it didn't work, and they actually changed their mind rather than just doubling down. So reality is our friend. It does make an impression on people. My fifth reason, and my biggest reason, is all of you. Beautiful day, beautiful city. You could have been anywhere else, but you're here. There's this expression, 90% of success is showing up, where you all showed up. And I know you're going to keep showing up. And I've talked to a number of people here who have worked for decades on this problem, and it's been inspirational to me. So I would say of all these causes of hope, the biggest one is the caliber and the compassion and the commitment of all of you. And I thank you for letting me spend a day with you.